Greetings, I'm Kevin Sowers, President of Johns Hopkins Health System and Executive Vice President of Johns Hopkins Medicine. And today, after an intensive nationwide search that included interviews with frontline staff, leaders, managers, directors at both Johns Hopkins Medicine and all children's hospitals, our physician leadership, and physicians who practice at all children's hospitals. Today, I have the great pleasure of introducing you to the new president of Johns Hopkins All Children's Hospital, Alicia Schulhof. Alicia, thank you for being here with me today.
Thanks, Kevin. I'm delighted to be here.
So let's start with what drew you to All Children's Hospital?
Oh, I was drawn first and foremost, and even to today, to the mission of the organization, the stellar reputation and brand, and most notably the people, many of whom you just alluded to. It's that culture of connection. With each interaction, I felt that palpable mission come through. And while I know we've just begun to scratch the surface, getting to know the team members, I'm so excited to jump in. And I think together with Johns Hopkins Medicine, Johns Hopkins All Children's will continue to shape the future of children's health. It was demonstrated just this week with the great recognition through U.S. News and World Report as a top children's hospital in the state of Florida. It's absolutely abundantly clear that parents and families are trusting us for their care and look to us for their medical expertise. And I can't think of a more incredible privilege than to help shape the future of children's health.
You know, Alicia, it's amazing because I would agree with you. Having spent a lot of time at All Children's Hospital, there's an incredible team of dedicated individuals who are committed to improving the health of children. So let's talk. A part of what struck me was your personal commitment to caring for patients and families and your experience in leading complex organizations. What drives your leadership style?
You know, you'll find me at the intersection where passion meets purpose. I'm committed to patients and their families and believe that we deliver the best care when our teams are focused on that mission with a mindset for continuous improvement. I think folks would describe me as having a servant heart, values-driven, and a builder of teams and vision and people. So I think doing all of that, keeping the patient and the family at the center is what's key and critical.
I would agree with you. That's a critical part of what we do each and every day. You know, do you have a story that connects your passion for being a part of an organization that impacts the lives of children?
Sure. You know, I knew I was called to healthcare early on. I had incredible parents and siblings that helped to grow and mentor me, but truly it was in high school. My husband and I were actually introduced by a mutual friend. His name was Chad, and it was in high school that Chad was diagnosed with cancer. He was wicked smart, had this huge heart, and his sights set on medical school. But when we were in high school together, you know, I think as he walked that journey, we walked alongside him during his experience with cancer. And he was one of those people that just lit up a room. But then also, I think he likely, while he was inspiring us as kids, he was likely inspiring his care team as well. And I would not be surprised if he left as many fingerprints on the hearts of his care team as they did on his. And it's truly in Chad's honor that each and every day I try and meet and get to know at least one more person, be it a patient, a family member, or a team member, because it's truly those experiences that give me hope for brighter tomorrows.
So Alicia, you're coming to us from Indiana. How have the experiences you've had thus far in leadership really shaped you for this moment and prepared you for this moment to lead Johns Hopkins All Children's Hospital?
Thanks, Kevin. I feel so fortunate to have the experiences that I've had in my career. You know, starting that first decade in my career was really about learning about data-driven decision-making and the art of asking careful and thoughtful questions. This last decade, I've really enjoyed digging into and falling in love with the academic environment, research and education, and really that environment and organization of learning. Cultivating that has just been incredible, and I've enjoyed it immensely. I'm so thankful for the rich diversity of the experiences that I've had. Most importantly, the mentors that I've had the chance to learn from, the physicians I've been able to partner with, and the team members and patients that have inspired me each and every day. Every experience has reinforced the importance of putting the patient and the family in the center of all we do.
That's great, Alicia. You know, you've had the opportunity now to visit St. Pete multiple times, and you've connected with team members there, and you've begun building some relationships there. What excites you about joining the team in Florida, and what are your plans for your first year of being there?
Yeah, my family and I are so excited to come back to Florida. You know, we've had this experience having lived there about a decade, but that was a decade ago. So we have and look forward to the opportunity to reconnect, get reacquainted with the community, and also become deeply rooted. My kids are heavily involved in extracurricular activities and their school activities, but you know, we enjoy kind of exploring the community together and giving back. Professionally, I'm excited to get to know the All Children's family, the constituents, the team members, the community. I look forward to hearing from all of those individuals and helping to cast a future together. You know, Johns Hopkins is a place of hope and healing, and I'm excited to help write the next chapter of our history.
That's great. I would agree. All Children's Hospital has provided a lot of hope and healing to many children in the region, and so there's only an opportunity to further expand and create even more excellence at All Children's Hospital. You know, Alicia, as a leader, what can our providers and our staff expect from you?
Yeah, you can expect me to be out and about rounding, observing, connecting, asking questions, and most importantly, listening. I'm looking forward to hearing the voices of all of those individuals we've alluded to, and can't wait to take the next steps with them together.
You mentioned a few minutes ago your husband and 4 children.
Yes.
Tell us a little bit about your family and how excited they are to come to St. Pete.
Yeah, we couldn't be more excited, Kevin. You know, we have what I call the PTO's favorite surveyor in my family, because through COVID we had a high schooler, a middle schooler, an elementary schooler, and preschooler. So you ask us a question, we can knock out a bunch of questions, but between them and our 2 big hairy dogs, we couldn't be more excited. We're so thrilled to be a part of the community, to jump right in, and the kids are always very involved in soccer and other athletic activities, so it'll be fun to cheer everyone on in the sidelines and continue to wear the All Children's gear too, and support the community in all the ways we can.
That's great, Alicia. Well, Alicia, on behalf of the entire team at All Children's and Johns Hopkins Medicine, I want to welcome you and thank you for your willingness to serve our community and our children down in Florida and the entire southeastern region of the United States.
Thanks, Kevin. I'm just delighted to have this opportunity to serve and to live our mission each day.
Thank you.
Thanks.